While we are in the month of October, we may be thinking about a lot of cozy hygge things happening, like Thanksgiving, falling leaves, Oktoberfest, and that it's finally time to get our sweaters out. Tomorrow is also a very important day, and it's a bit different than all of the other things that I just mentioned. It's Breast Cancer Awareness Day. Although most breast cancers are found in women who are 50 years or older, about 10% of all new cases of breast cancer are found in women who are 45 years or younger. And it is even possible to be diagnosed at 18 years old. The statistics suggest that women 45 years old and older should have a mammogram every year. Early detection is key. A mammogram can find any changes up to 3 years before they can be felt. Even if you are already having your yearly mammogram, it is important that you pay attention to any changes that might be felt in your breast. It is important to perform a self exam every month because even mammograms can miss up to 20% of breast cancer, and cancer can develop between mammograms. Starting at the age of 20, every woman should perform a monthly self exam. Andrea will show you how to do this. But before that, let me ask you if you've ever heard any of these. If the lump hurts, then it is breast cancer. If the lump is smooth and it moves freely under the skin, then it's not breast cancer either. These are myths that you should not believe. The fact is, any lump or any unusual mass needs to be checked by a doctor. When you start performing these self exams, you will get to know your body better, and this will help you to detect any unusual changes.
The first thing you need to know is that our breasts change a little during our cycles. So it is important that you do the self-exam the same day of your cycle every month. If you suffer from sensitive breasts during your period, it is important that you wait until you are no longer sensitive, because if not, this will be a painful process for you. What we are looking for in this self-exam is any change on the shape or the size of the breast, pain in any area of the breast other than menstrual sensitivity, nipple discharge other than breast milk, including blood, a new lump around the breast or the underarm area. So this self-exam is to be done naked. So I'm just going to show you how to do it. Remember that we are looking for any discharge, pain, or lump. You can use massage oil and your moisturizer, or even you can do it in the shower with soap in your hands. There are three patterns we can use. You can do the three of them or only one, applying a medium pressure. You will use the pads from your three middle fingers, and to start you will put one of your arms behind your head. The first pattern would be up and down. So you will put your hand behind your head, use the three middle fingers and start. It is important that you do it from your armpit, like here, every this area and all around your breast. So you will start and pay attention if you feel any pain or any new lump. Then you will do the same thing with your other breast. The second pattern you can use is from the outside to the nipple. So again, you put your hand back on your head, three fingers, then the outside to the nipple. And so all your breast. Then you will continue with your other breast. And the third pattern you can use is circles. From the outside and then getting to your nipple. You can do this 2 times, and then you will continue with your other arm. Now that you have explored your breast with your touch, now it's time to look at the mirror. So you will put yourself in front of the mirror, then naked, then you will put your arms on the sides and see them. See if there's any change in the size or shape, or if there's something that you haven't noticed before. Then you will put your hands on your hips and tighten your chest muscles. And also in front of the mirror and see if there's anything different on the shape of your breast. And last, you will put your hands on your hips and bend forward in front of the mirror so you can see if there's any change in your breast. And that's it. It's simple, it's fast, and it's important that you do it once a month. Remember, the same day of your cycle.